It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Welcome back. Our next guest, Dr. Sara Jurek, orthopedic and sports medicine surgeon, discussing her background in ortho and total shoulder surgery. For younger patients, we don't think about younger patients needing shoulder operations, Shannon, but I guess at some point they do, especially those youngsters maybe who are throwing baseball around a little too early, a little too far, a little too hard.
Yeah, you know, Tom, the shoulder is a joint that normally doesn't wear out like the hip or knee, but when it does wear out, the neat thing is in today's world, there's options to replace that shoulder with a normal configured shoulder structure.
All right, Dr. Sara Jurek and Shannon O'Kelley.
Dr. Jurek, thank you again for joining us on Health Talk. How are you?
I'm doing great. Thanks for having me.
Well, thanks for coming on. We know you're an orthopedic surgeon working in Seattle. Tell us about your practice, kind of your background, because we're going to talk about the shoulder today, but we're going to talk about the shoulder from a perspective of how do I replace it, i.e. a total shoulder replacement. But tell our listeners again, catch us up to your practice and your interest in your practice.
Okay, perfect. My practice is shoulder, so it's a great topic for me. I originally trained in sports medicine as well as shoulder surgery, so over the past few years, I've really tailored it to really specializing in shoulder surgery. So I do a lot of arthroscopy, rotator cuff repairs, and all the way up to replacements and fracture surgery. And so I primarily focus on the shoulder, but I'll occasionally do trauma and do other things. But for the most part, it's shoulder for me.
Well, I mean, the shoulder is a fantastic joint. It's a fascinating joint. It has such impressive movement or mobility, and it lacks stability. Maybe set us up anatomically, the shoulder, how it moves, the planes it moves in. Why is it so complex, and why are you so interested in it?
I do love it because it's so complicated. And when I was in medical school, I was terrified of the shoulder because I didn't understand it. And I decided either I would learn everything I could about it and really embrace it, or I would never do it again. Never treat it. And so the shoulder, moves almost in every plane. There's actually two joints. There's the ball and socket joint. That's one we're going to be talking about today, the glenohumeral joint. And there's the smaller joint where your collarbone and your shoulder blade meet up, your AC joint. Both can cause problems, but they kind of work together to give you a huge range of motion. And like you mentioned, the shoulder is unique because it is unstable. If you think about the hip joint, that's also a really complicated joint, but that's a really stable joint. So the socket, it's a bony socket. It's really deep. When the ball seats in there, it's pretty solid. And the shoulder is the opposite. It's like a golf ball on a golf tee. Nothing is keeping it in place except for the soft tissues. And that's where the complicated portion of the shoulder really comes into play. There's a lot going on with the soft tissues, the muscles, the tendons, the ligaments that keep things stable and hopefully don't hurt too much.
Well, it's a very mobile joint like you just described. It's not a significant weight-bearing joint, so a lot of times you don't hear about the shoulder joint. Tell us why you would consider replacing a shoulder or doing a total shoulder. Believe it or not, listeners, they are doing total shoulders. I would never imagine 34 years ago when I started physical therapy, they would be doing total shoulders, but that is an option today. So tell us how that happens, who it happens to, and what about if it happens to a younger person? We'll get into all that nitty gritty, so to speak.
Right. So it is the third most common joint replaced. So over time, especially kind of with just the population in general being much more active, shoulder arthritis and situations or conditions where the shoulder needs to be replaced it's been happening more and more frequently. Usually it's an arthritic process, but as you mentioned, we'll talk about younger patients. Sometimes it's a little bit different than true arthritis, but when the cartilage, which is the cushion on the end of the bone, when that wears out over time, which happens in every joint or can happen in every joint, it happens in the shoulder. When that happens, then if we can't treat that non-operatively, then we would consider doing what's called a total shoulder arthroplasty or shoulder replacement surgery, where we basically give you new surfaces and try and relieve pain that way through surgery.
And so when you talk about this shoulder replacement, a lot of times you hear a reverse total shoulder and then the anatomically accurate total shoulder. I want to talk about that. So on a reverse total shoulder, let's talk about that, what that means, i.e. reverse, and who is going to benefit from that.
Yeah, so that's a really unique replacement. The shoulder is really the only joint where you can do it. And it's called a reverse exactly because it reverses the anatomy. So if you think about the shoulders being a ball and socket, it totally reverses that relationship where you take the socket and you put a ball into that, or basically half of a ball. And then you take the ball and you put a socket there. And by switching the anatomy, it lets you use your big motor of your shoulder, the deltoid muscle, to power the shoulder. And patients who have arthritis but don't have a good rotator cuff are perfect candidates for this reverse total shoulder arthroplasty. So usually it's an older patient population. Sometimes people with certain fracture patterns will get a reverse.
Back with Dr. Sara Jurek and Shannon O'Kelley after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelley with more IRG Health Talk.
We continue to talk about the shoulder, especially when it pertains to young patients. Here is Dr. Sara Jurek with Shannon O'Kelley.
Dr. Jurek, again, thank you for joining us here on Health Talk, and thank you for doing such a wonderful job setting up options to replace a shoulder that is worn out. A friend of mine, 57 years old, had his shoulder replaced. He was an active skier, but probably from trauma, just wore his shoulder out. At 57, he had it replaced. Tell our listeners, is that a reverse shoulder you're doing, or are you doing anatomically correct shoulder? How does that work for someone younger?
So almost always for a younger patient in their 50s, that would be an anatomic total shoulder. And that means we simply give you new surfaces. So I tell my patients, you wore the tread out on your tire and you need new tires. Basically, you're replacing the ball with the metal ball, and the socket with, usually it's a combination of a little bit of metal and then a plastic piece to function as the cushion. And that we can do that in younger patients because most of our younger patients have healthy rotator cuff tendons and they just need new surfaces. So your buddy, the skier, I'm assuming he probably had a bunch of instability events, maybe dislocated a shoulder a couple times, and that led to cartilage damage. And then he ended up with the replacement. So he will do great with that. He'll be able to ski. He'll be able to be active again in a way that he probably was really struggling with before surgery. The whole goal of this surgery, well, I guess the primary goal is pain relief, but the important secondary goal is function. You can do your normal activities. And the only athletes that I tell, or I kind of tell them, hey, rein it in a little bit, are if I have any bodybuilders or power lifters. I don't want them lifting, crazy amounts of weight repetitively, but starting a lawnmower, using your shoulder to do the fun things that you want to do. That's the whole point of this procedure. So yes, he'll be able to get back to all of that.
And when you replace that, your approach there, you're going in, you're moving tissue aside. You're not really, are you cutting any muscles or rotator cuff? He should be okay from a standpoint of being able to strengthen up the shoulder after surgery.
Right, exactly. The way that you get into the shoulder to replace it is you don't cut the muscle, you just separate. There's a couple of areas that you can kind of go between, which is a safe way to get in there. And you do actually have to take off the front part of the rotator cuff, the subscapularis, to do the shoulder replacement, but you fix that on your way out. So that's why you have to take it easy for a couple of months after the surgery to let that heal. Once that's healed, then you're golden.
And if I'm a younger person and I have just this chronic pain and dysfunction of my shoulder, this total anatomical shoulder replacement is a very good option. And I can probably get back to activity when? I mean, what is the normal return to activity?
Right. Usually return to normal sports activities is somewhere 4 to 6 months. Normal just day-to-day activities is usually anywhere from 6 to 8 weeks. So you're out for a couple months. It slows you down, but it's doable. And it's a great option. If you're young, the best thing to do is to try and avoid surgery as long as possible. But at some point, you get to the point where your quality of life is just significantly impacted, and then you pull the trigger and you have it.
Well, quality of life. And when you can't lift overhead or reach behind your back or do simple things because your shoulder is so painful, I mean, getting it replaced and repaired changes one's trajectory in quality of life. So, Dr. Jurek, thank you so much for your time.
Absolutely.
Okay,
thanks a lot.
Yeah. You've been listening to Dr. Sara Jurek. More information at seattleshoulderdoc.com. And we've talked a lot about it, Shannon, particularly at this time of the year. Baseball, kids maybe starting to try to throw a curveball. It hurts their elbow. But shoulders are very critical part of the throwing motion because it's an unnatural throwing motion when you are trying to come over the top to throw a baseball.
Yeah, exactly. Shoulder is a joint that is pretty fascinating. A lot of mobility, lacks stability, but is supported by this rotator cuff. But, if you've had a history of dislocation of shoulder or shoulder trauma and your joint is worn out and you're young, the option now to get that replaced and return to some functional pain-free activity is very good. So it's interesting stuff, the technology that we're moving into with total joints.
All right, our next guest right after this time out on Como.